Hi, this is Dr. Bunkis, Orange County plastic surgeon, Newport Beach, California. Today we're doing a phenol peel, and we started by adding 3 cc's of phenol. We added 2 cc's of water, and now we're going to add some croton oil and soap. And this is the traditional baker's formula. We need 3 drops of oil, and we need 8 drops of the soap. Then we mix the solution up, and it's ready to be put on the face. But first we've got to clean the patient's skin with some acetone to remove all of the natural oils in the skin, and that way the peel will be more effective. We had some numbing cream on the face. We've wiped it off, and now we're going to clean the face with some acetone. And it doesn't smell very good, does it? Smells like nail polish, remember?
Because it is.
It is. And the part where we got to be careful is around the eyes. And here we use a Q-tip. Open your eye up, dear. Just look straight up. We just want to get it right up to your lashes. Open up. Okay, you can close them now. And when we apply the baker's solution, we apply it in sections because the phenol can get absorbed into the blood. We want to make sure that the blood level doesn't get too high, doesn't cause her any arrhythmias. As you can see, we're monitoring the patient. And we'll start by doing the forehead, the nose, and the lips, kind of the central T, and then we'll do the cheeks individually. Yes, and this is what it feels like, and you'll see it stings a little bit. And what we're going to notice is that the skin starts turning white. It's called frosting.
Mm-hmm. Yeah, I feel it.
You feel it. I'm sure you do. I go right up into the hair because I don't want a little white line right by the hair.
Does it make your hair fall out or anything?
No, no.
Okay.
You told me to focus on that nose, right?
Mm-hmm. The nose is rough. Look, 10 years ago I had some problems with stuff that wouldn't heal. Thought maybe it was precancerous.
See, we're monitoring her heart over there. We can see every heartbeat, and so far she's doing great. This whiteness that you see, we call that frosting. And as soon as this is on, my assistant Gabby will go and get her some cool compresses, and we'll lay some cold compresses on this part. You're a trooper. You're doing really, really well. Okay, now we're just going to wait 10 minutes or 15 or so for this stuff to work, and we'll put a cool compress on her. Okay, we're starting the last side. We did open your eyes, dear, just so I can get a little bit underneath here on your lid. But you can see it's frosting very nicely. And we do these patients with a topical numbing cream on to start with. And then we put a little Aquaphor or Vaseline on when we're all done.
Okay.
They also get a little oral Valium, as you can see. She's fairly comfortable throughout all this. And as soon as we're done, we put on the, pass me the Aquaphor please, and the tongue depressors. Kind of a generous supply of this stuff.
Or is that all the acid done now?
All the acid's done. You didn't miss a heartbeat. Open your eye just a little bit so I can get a little bit closer to the eye. That's perfect.
And do you do the upper lids?
We don't have to do the upper lids. You don't have any sun damage there, you don't have any wrinkles there, but the lower lids I did right up to the lashes, because those were pretty bad.
They are.
But you look fabulous. You're going to look all raw and soupy for about a week. And then when the new skin comes in, your skin will be much, much smoother and nicer.
Okay.
And we've given you all the instructions about the vinegar washes and so forth. The only thing, just make sure you stay out of the sun.
Yeah.
Okay, that's how we do full face phenol peels at Orange County Plastic Surgery, Newport Beach, California.